Good afternoon, ladies and gentlemen. I'm very delighted to be here and speak in Korea University and UC Irvine Joint Symposium in 2020. And I appreciate to the organizing committee from University of California at Irvine and the Korea University of this symposium to invite me. I'm Jae-Uk Choi, a professor of College of Medicine, Korea University, and the president of the Korean Society of Global Health as well. The topic of today's presentation is to share my opinion as a global health scientist on urgent need for global cooperation to COVID-19 pandemic. So I'd like to introduce some of the issues in the current situation on COVID-19 in globally. As of 23rd November 2020, there have been 58 million of confirmed cases of COVID-19, including 1.3 million deaths reported to WHO. Currently, the third big wave of the COVID-19 pandemic appears to be the beginning worldwide. The resulting daily new cases and death rate is very threatening coming several months. More seriously, the IHME, Institute for Health Metrics and Evaluation of University of Washington's institution. This institution's the COVID-19 pandemic's projection study reports that the third pandemic could occur from December of this year to March of 2021. As you can see on the slide, you can see the global COVID-19 incidence curve for each of the three prediction scenarios. As you can see on the slide, it is predicted that the curve of deaths from the third wave will peak at the end of January 2021 with a maximum of 37,000 to 7,000 deaths per day. In Korea, as of November 24th, the number of COVID-19 confirmed cases is 31,000. The death cases is 510. And the case fatality rate is 1.64 point. The number of new confirmed cases per day is increasing recently, reaching over 300. And it seems that a third big wave of nationwide community infection is beginning. From November 24th, the social distancing program was strengthened and the second level of social distancing program began in Seoul and remote area. On June 13th, the SDGs and COVID-19 reports released by the SDSN, Sustainable Development Network in UN, the University of Cambridge and the Jeffrey Sachs Group led the global evaluation of performance, especially regarding to response to COVID-19 pandemic. According to the report, Korea was evaluated as a country with very good performances in responding to COVID-19 among OECD countries. Actually, in fact, it's our Korea, the rank is top ranked among the OECD country. And in particular, performance indicators such as the death rate per million people, epidemic control efficiency, and degree of social mobility restrictions are showing pretty good results. To summarize the recent situation, global situation is as follows. The world is facing a third big wave of COVID-19 pandemic. Economies are in a deep and growing crisis. Inequalities, poverty, and hunger are rising within and among countries. This crisis could be the worst since the World War II, World War II, and the economic ramification could be similar those of the Great Depression in the 1930s. The choice between death and the economic collapse is really no choice. The only viable option for all society is to build effective public health systems that can contain the pandemic, which could even allow business to operate. Recently, the results of an interim or the final clinical trial study showed that the vaccines of Pfizer and BioNTech Germany have over 90% corona infection prevention effect. However, this is not the final conclusion, and we have to wait a little longer from the United States FDA approval. In addition, if the above vaccine is approved for use, it is an emergency use permit, basically. So there is a possibility that it will be stopped at any time during the vaccination process due to unexpected side effects, etc. So it's another issue about the transportation. Keep the store in the below minus 70 Celsius degrees. And also another the global vaccine issue is equitable access to COVID-19 vaccine, especially in the middle and lowest income countries in Africa as well. The COVID-19 vaccine is still highly uncertain, and even if the vaccine becomes available in the first half of the next year, the issue of vaccine safety and effectiveness will continue, as it is under the emergency use approval procedure. In addition, international cooperation on how to solve the problems of equality between countries related to vaccination is very necessary. The social distancing issue is an unavoidable reality, as we all know well. Most strict social distancing policy aggravate socio-economic impact and equality in health. And long-term social distancing cannot be sustainable during COVID-19 outbreak. Korea is also preparing to change our social distancing program over the past 9 months, as shown in the slides. Globally, discussions on the importance of herd immunity policy, as well as an alternative to the easing or shifting of social distancing policies, are in earnest recently. In the midst of such discussions, as you can see on the slides, the situation in the United States and Europe is very contrasting, and it is even confusing. France, Britain, and Germany have resumed the social lockdown again, while the United States emphasizes the importance of easing social distancing and herd immunity. First of all, I'd like to introduce the Great Barrington Declaration, which has been initiated by some scholars, insisting on easing social distancing and introducing herd immunity policy. This declaration was released on October 4th. I will not summarize it. It would be important for all of you to read this declaration by yourself carefully. However, I will introduce some sentences as I read them. So, for example, the current lockdown policies are producing devastating effect on short-term and long-term public health. The results include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screening, and deteriorating mental health, leading to a great excess mortality in years to come. Our goal should therefore be to minimize the mortality and social harm until we reach herd immunity. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are at highest risk. We call this focused protection. So those who are not vulnerable should immediately be allowed to resume life as normal. Simple hygiene measures such as hand washing and staying home when sick should be practiced by everyone to reduce the herd immunity threshold. As soon as the Great Barrington Declaration came out, public health scholar objections against the declaration's claim was published in the Lancet Journal on October 14th. So the objections, the claims, have published their claims under the name Johnson Memorandum. And it is surprising, interesting, and embarrassing to see the number of people signing in favor of each claims, as if each claims is more popular like online voting games. The numbers signed by opposing scholars are shown at the top of this slide. Due to limited present time, I will try to read only a few sentences. So they said, this is a dangerous fallacy unsupported by scientific evidence. This means the herd immunity fallacy. Furthermore, there is no evidence for lasting protective immunity to SARS coronavirus following natural infection and in endemic transmission that would be the consequences of one immunity would present a risk to vulnerable population for the indefinite future. Japan, Vietnam, and New Zealand, to name a few countries, have shown that robust public health responses can control transmission, allowing life to return to near normals, and there are many such success stories. The evidence is very clear. Controlling community spread of COVID-19 is the best way to protect our societies and economies until safe and effective vaccines and therapeutics arrive within the coming months. So, what is your decision? Before I come to the conclusion, I'd like to talk about a few things. First is the importance of global health cooperation on the COVID-19 pandemic, which is also the theme of this joint conference. The controversy over the policy of herd immunity and social distancing, which is being discussed in the context and perspective of some developed countries, is difficult to accept in the international community, mostly low and middle income countries. And also, currently, it is too early to evaluate the global or nation's response against COVID-19. The global COVID-19 crisis is still ongoing. We are just in the mid-half of the boxing game, COVID-19 pandemic, for example. COVID-19 still has a lot of scientific uncertainty, and there are no panacea like a silver bullet. The debate is heating up recently among public health scientists in the United States and Europe over social distancing and herd immunity. This kind of academic debate, generally the academic debates and struggle will be helpful in terms of the development of science, but this kind of the debates should be avoided from being politicized and or transformed into a political slogan as well. It is also difficult to determine which country or policy will be the final winner after the end of the COVID-19 pandemic. As considerations for such evaluation, not only the number of confirmed cases and deaths per populations, but also the magnitude of health damage due to non-corona disease is important. But ultimately, the violation of basic human rights of the people, such as the human rights and freedoms and the damages of social solidarity, etc. So I think it will be very complicated and difficult regarding with the evaluation of the nation's, one nation's response to COVID-19. It is necessary to make harmonization between quarantine policy, including herd immunity, approach based on scientific background, and social distance policy based on social consensus as well. So at the moment, the three specific actions should be implemented to raise global health security and support medium and low-income countries to COVID-19 and after pandemic. First, assesses the response capabilities of medium and low-income countries in terms of testing, tracing, and treatment, and figure out what would be the best way to support. The second, we should provide the financial support to medium and low-income countries which cannot implement social distancing due to socio-economic laws. Third, we should organize global health alliances among mid and low-income countries to establish systemic and effective responses against infectious disease. So I'd like to introduce my opinion about the urgent need of regional cooperation to COVID-19 pandemic. The first, we should disseminate the best practices and strategies for fighting COVID-19 adapted in the East Asia and Pacific region as a policy in our country, in their country. So we could use the very effective delivery arm of the ODA, Official Development Aid, the bilateral ODA project. It could be one of the very effective delivery way to disseminate the best practice and strategy to other countries. And we should strengthen the financial mechanism for developing country. For example, the IMF and World Bank and the ADB, with the cooperation with such multilateral institutions, we should make it strengthening financial mechanism for developing country. And also, we should address the hunger hotspots in some countries. We could cooperate with the Office for the Coordination of Humanitarian Affairs and FAO or the World Food Program as well. And also we should focus on the ensure social protection with a new global fund for social protection that was proposed to address the SDG goal number 1, no poverty. And finally, we should promote new drugs and vaccine, and we should make it the platform for the to make it the global fair distribution of COVID-19 vaccines is an urgent global issue. We have experience with some lessons or some kind of the lack of information from the early phase of COVID-19 pandemic. For example, lack of information and understanding of COVID-19, such as the effectiveness of masks and asymptomatic patient importance and infection itself as well. And lack of social consensus on COVID-19 framework and measures are another big issue, another big issues. So especially in the social distancing and the herd immunity policy. And another one is the lack of medical responses and the treatment, including vaccine, especially in the early February and March. We didn't have any kind of enough information about the medical therapeutics and the medical treatment regimen and the vaccine issue as well. And also, we have experienced a weak global partnership as well. The weak global partnership could be a big issue in the future. I'd like to introduce the regional platform model for COVID-19 responses. As presented in this slide, we would like to propose a regional platform for urgent response to the outbreak of a new infectious disease. I think that if it is developed based on Korea's experience and lessons learned, and especially taking into account Korea's ICT-related technological achievement, we can build a regional platform for emergency response to infectious disease. In addition, these regional platforms will be able to spread and share this platform model in countries where local languages and political, economic, and social system can be classified into similar blocks. Thank you for listening my presentation. And once again, I appreciate to the organizing committee for preparing the Korea University and UC Irvine joint seminar. Thank you. Bye-bye.